Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today, we are joined by County Executive Armin Budish, Board of Health Commissioner Terry Allen, and Board of Health Medical Director Dr. Heidi Gullett. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Hello, everybody. I'd like to thank Board of Health Commissioner Terry Allen and his team for their ongoing dedication to keeping residents safe. You know, when you have a team working as hard as they are doing to keep people safe, it's hard to go overboard with appreciation. So I'll just keep saying thank you. Speaking of heroes who keep us safe, tomorrow is Veterans Day. It's a day when we really take the time to acknowledge and appreciate and thank the many people who have served our country. They give so much, even their lives, to the United States. They make the ultimate sacrifice. Only the most selfless and courageous are able to make that commitment. They've given a lot to our country, and it's time that we give back to them. A lot of you probably remember when the National Guard was in town earlier this year. The governor brought them in to help with the mass vaccination clinic at the Wolstein Center. Their help administering thousands of vaccines to residents across the region was huge in helping decrease our COVID rates. The National Guard is responsible for responding to domestic emergencies and reconstruction efforts. Members of the National Guard have civilian jobs or attend school while conducting their military training part-time. The Ohio National Guard Scholarship Program provides full tuition assistance to soldiers to support their post-secondary education. This can be really helpful in getting soldiers into school because it eliminates the financial barriers many students face. But more work can be done to ensure that the soldiers graduate and get jobs. In fact, less than 25% of recipients of this scholarship complete 2-year degrees, and less than 50% complete 4-year degrees. I believe there's also more work that can be done for soldiers of color. For example, when pursuing 2-year degrees, 27% of white Ohio National Guard scholarship students graduate compared to only 13% of black students. Taxpayers spend nearly $16 million on this scholarship program annually, over $1 million of which is spent on students who never complete degrees. And many of the students who do graduate could get better jobs and reduce their debt. We can help improve these outcomes. So I'm proposing to County Council a pilot program in partnership with the Ohio Department of Higher Education, an Ohio National Guard Scholarship Pay for Success project. We'll help veterans get into school, stay in school, and get good, well-paying jobs after they graduate. We'll do it by combining financial aid and coaching services. Here, the coaching services are the secret sauce. The pilot project would work with the Ohio Department of Higher Education, the Adjutant General's Office, and a service provider to leverage Pay for Success to fund customized pre-enrollment and first-year coaching services to each person who receives a scholarship. The project aims to improve outcomes for all students and eliminate equity gaps. This has the potential to provide services to hundreds of scholarship recipients every year. Utilizing a pay-for-success model for this project allows the county to bring in outside dollars to fund the program. We only pay if it works to actually increase graduation rates and improve job placement. This program is still under development, but we expect to bring it to council in a few months. This work can complement services already being offered by colleges and universities. I look forward to the benefits this program can offer. What better way to celebrate our servicemen and women for Veterans Day? Thank you. And with that, I'll turn it over to Commissioner Terry Allen.
Thank you, Executive Budish, and as always, we appreciate your support and your urging vaccination throughout this 21 months and counting. So I think today we'll start off talking a bit about flu. So our flu surveillance program for the 2021-22 season indicates that flu activity is currently and thankfully low. And you can view our comprehensive weekly reports on our website at ccbh.net. If you choose F under the A to Z index and click on Flu Weekly Surveillance Reports, you can pull up our latest report, and we'll be monitoring that every week throughout the flu season. Widespread masking and social distancing and travel restrictions have substantially reduced the flu risk last year during flu season. In fact, there was almost no flu to be had here in the United States. It was an extraordinary year. Given that many COVID restrictions have been eased, and businesses have reduced remote work arrangements, we're closely monitoring the data. As flu activity this season remains very unpredictable, the flu vaccine can prevent complications such as pneumonia, and ultimately it saves lives, just like the COVID vaccines do. Cuyahoga County remained over 3 times the threshold for high transmission as defined by CDC, with all 88 counties in high transmission. And I'll note that in fact, we're beginning to trend in the wrong way, as we may be approaching 4 times the threshold for high transmission. So this is a very, very critical point during our vaccination campaign and also reaching children. The best way to prevent what has been called the twindemic of flu and COVID is to, of course, get vaccinated for both. So moving on more specifically into COVID, Cuyahoga County remains at over, as we mentioned, at a high transmission rate, and our area hospitals continue to report high utilization of adult and critical care beds in the community, which is currently at 83% of their capacity to treat patients who may present with any illness, 83% of all the beds for adult and critical care use. They have to continue to triage patients based on the level of need and are delaying certain procedures in order to reduce, and also reducing visitation in order to work to slow the spread that we're seeing right now. Staffing shortages continue to exacerbate the situation on the ground in these hospital systems. So please get both your COVID-19 vaccination and your flu vaccination, because it will protect our hospital capacity, and make sure if you need a bed or someone you love needs a bed, that it's there available for you should you need help. The indoor masking advisory in Cuyahoga County that we issued on September 15th remains in place, and it's been particularly important in the school setting, where cases among students and faculty have been high, and they've been going up over this past week. The Ohio Department of Health Director Dr. Bruce Vanderhoff released a statement on November 1st, urging schools to continue universal masking to prevent another uptick. Dr. Vanderhoff also said that as of November 1st, more than 2,000 Ohio children under 18 have been hospitalized with COVID-19, and 15 had died. Nationally, the virus has taken the lives of nearly 800 children. Remember, if you want to keep our schools and workplaces open and prevent more of our residents from getting COVID-19, and ultimately to bring an end to this pandemic, we need to meet the imperative to vaccinate more people and embrace universal masking indoors. If you're unmasked and unvaccinated indoors and around others, your risk for contracting COVID-19 is very high and will remain so throughout the coming months. And the holidays are coming, and people will be, of course, with family and friends, and that risk will increase if you're unprotected. So roll up your sleeves and protect your family for the holidays. On the vaccination front, about 56% of county residents have been fully vaccinated. And when we look at the equity perspective, about 36% of African American population and 48% of the Hispanic Latinx population have been fully vaccinated. And so we continue our work in the community to make vaccines easily accessible, to address people's concerns and fears, and to offer those vaccines in areas, vulnerable neighborhoods where we can reach people and that it's readily available to them. Many of us remain unvaccinated and vulnerable, consequently, and vulnerable to this Delta variant in the community. And so remember, you can go to a health department, you can go to your federally qualified health center, your community health centers, pharmacies, or hospitals to get a vaccine, and they're widely available. And so we know that if you're vaccinated, that it prevents hospitalizations and fatalities associated with COVID-19. So it does a good job of keeping you out of the hospital and can save your life. We continue to offer $100 cash cards for those who receive a first dose at our Board of Health clinics. And these cards are only for first dose and not for second dose or boosters. The location of the dates and times for these clinics are available on our website at www.ccbh.net. Choose COVID-19 information from the drop-down menu, and you'll find the COVID-19 clinic schedule. Our first dose clinics are listed under community clinics. You can also go, of course, to 211, and they can help you sign up, or go to the gettheshot.coronavirus.ohio.gov to sign up for an opportunity to get vaccinated. Booster doses for Pfizer, Moderna, and J&J are available for eligible recipients, and you're eligible for Pfizer or Moderna booster if you received your second dose at least 6 months prior to the date of the booster clinic and meet CDC's eligibility. If you're over 18, you're eligible as the only criteria for a J&J booster. We're also very happy to report, and we'll hear more from Dr. Gullett about this, that vaccinations for 5 to 11-year-olds have begun in the community. As of this morning, on the Ohio Department of Health website, it's reporting that almost 1,700 kids have started vaccination in the county. And we know that our Children's Hospital, Rainbow, also has several thousand vaccinations scheduled in the community. So that's a great start to this new campaign. And Dr. Gullett will, as I mentioned, will be sharing the importance of keeping children safe and vaccine being the way to do that. On the testing front, we remind everyone to get tested if you're experiencing COVID-19 symptoms. And we're seeing, of course, an increase in testing volume with the emergence and the continued spread of the Delta variant. 9.3% of residents tested in the county, 8.3% of residents tested in the county are positive from the previous week data, but it appears to be creeping back up, as I mentioned, our positivity rate. We advise parents, students, school faculty, and administrators to go to retail pharmacies to get tested, especially for asymptomatic exposed students and patients. Area libraries also continue to distribute kits that they get for your rapid antigen screens, the kits they receive from the state health department. Please do not go to the emergency department for testing. We need to keep our emergency rooms free to help those most in need. On behalf of the Board of Health, we won't be seeing you before Thanksgiving, so we wish everyone a safe and peaceful Thanksgiving. And please get vaccinated now as your appreciation and thanks for your relatives and friends and the people that you love. And finally, importantly, echoing Executive Buttigieg's statements, we know that there are 19 million U.S. veterans as of this year, according to the Department of Veterans Affairs. And tomorrow we pause to recognize their extraordinary bravery and their sacrifice on behalf of all of us. So we offer a moment to reflect and appreciate our U.S. veterans. And with that, I'll pass things off to Dr. Gullett. Thank you.
Thank you very much, Terry. I'm very grateful to be with you and County Executive Buttigieg today. I'd like to take a few moments to reiterate a few things that both of them have shared, and then also share a little bit of additional information, hopefully to provide some clarity around what has been confusing with a lot of different information with regard particularly to vaccinations. We have continued, unfortunately, to see both continued transmission of the COVID-19 virus, but also loss of life. And as much as all of us truly want to go back to life without COVID-19, the reality is that this is continuing, and we still have families in this community that continue to lose loved ones. And we, on a daily basis, get reports of people dying in our community from COVID-19. So I want to just bring us back to the humanity of this situation and our shared humanity. And everything that we're sharing with you is simply to give you the right information so that you can make the best decision you can for yourself and your family, especially as we head into these holiday seasons where people are longing to spend time with one another. With regard to the things we know work, it's really important to consider masking. I understand that we've all grown weary and tired of these things we call mitigation strategies, these things we know prevent infection from spreading. But masking is the simplest and easiest and most protective thing we can do in the moment. So we certainly want to reiterate the importance of masking, regardless of whether you have been vaccinated with 1, 2, or 3 doses at this point of the vaccine. We know that it's really important as people become sick to also be tested. I think as time has gone on, we went from a year and a half ago in March of 2020 to having virtually no testing capabilities to now having such abundant testing capabilities that much of it is going unused. So it's really important that if you are to develop any symptoms, even if you think you have a sinus infection or a cold, it's very important to get tested for COVID-19. I myself, in my clinical practice, order many COVID-19 tests every week, and some are positive and some are not. People have other viruses that circulate this time of year. But it's essential to know so that we can continue giving guidance about isolating and staying away from others, particularly those who are most vulnerable from complications to COVID-19. So I would strongly encourage you to consider using both masking indoors and testing as much as possible over the coming months, and particularly in the time between our holidays over the next 6 to 8 weeks. We have a lot of testing capability in this community. You can get PCR testing. That's where we do a nasal swab and it goes to a lab and they tell you whether or not you have it in about 24 to 48 hours. Or the antigen test that you can get at local libraries, community health centers, and other locations. All of these are covered and will not cost you anything, but it's essential that if you are sick or you think you've been exposed, to please utilize these testing capabilities in our community. Particularly if someone at one of your gatherings is positive, it's important for others to become tested. And we definitely have the capability. You don't have to be a patient at the community health center, or you don't have to have a pre-existing relationship or a library card. You can just walk in and get one. I next want to move on to vaccination. There's been a lot of confusion about vaccination in recent months, and I want to try to provide some clarity for all of the recommendations we currently have. The COVID-19 vaccination, as you heard Terry mention, is all about keeping people out of the hospital and keeping people from dying of COVID-19. It works. And it has saved thousands and thousands of lives in the many people who've been vaccinated in our country and others so far. But it's essential that we get as many people as possible vaccinated. So even if you haven't had a dose yet and you have questions, we want to be able to answer those. Your primary care provider wants to answer those so that we can help you to become protected, to stay out of the hospital, and to have any complications such as a very severe illness that lasts for months or years, or dying from this virus. The other issue is as you spend holidays together, you're likely to be with people who maybe are more vulnerable than you, who are older than you are, or who have medical problems that put them at very high risk for COVID-19 complications. So we would just ask you to consider that vaccination if you haven't already had it, and please reach out if you have any questions that can be clarified. We strongly recommend that for anyone 6 months and older, that they receive an influenza or flu vaccine. This is the annual flu vaccine that we recommend every year. But to reiterate, it is for 6 months and older. For those 65 and older, there's also a high dose version that we recommend. Those can be obtained in lots of primary care offices, hospital settings, and lots of pharmacies in the community. And the flu vaccine can be given at the same time as the COVID-19 vaccine, regardless of which dose you might be receiving. Additionally, we recommend both the influenza and COVID-19 vaccinations for pregnant women. It is essential that we cover people who are pregnant for both of these infections, as they're both high risk for complications during a pregnancy. Additionally, we now are able to offer vaccinations for COVID-19 for all those in our community 5 years and older. So we know that those 5 to 11 and 12 to 17 currently can receive the Pfizer vaccination, and it is abundantly available in our community in lots of different locations, which I'll get to in a moment. Additionally, those 18 and older are eligible to receive either the Johnson & Johnson, Moderna, or Pfizer vaccines. If you have already had the Johnson & Johnson vaccine 2 months ago, or the Moderna or Pfizer second dose 6 months ago, You are also eligible for what is being called a booster dose. Those can be mixed and matched different vaccine than you previously received. And we would encourage you to talk to your personal healthcare provider if you have questions about which booster would be best for you. But they are all three abundantly available in our community. I'd like to just also take a moment to clarify some confusion around immunocompromised status, or people who have a low immune system, and the recommendations for their COVID-19 vaccines. Back in August, the FDA and the CDC both recommended and approved a third dose of a vaccine for those who are immunocompromised. So those are people whose immune systems, their infection-fighting cells, are limited due to infection, chronic disease, or certain medications. Those individuals were able to receive a Moderna or a Pfizer third dose, and that was considered part of their primary vaccination series. So most people would receive 2 doses and be fully vaccinated, but because their immune system needed an extra support, they received a third dose. You may have heard that there is now a recommendation from the CDC that those people receive a booster 6 months after that third dose. And I wanted to just clarify today that that is for people who have compromised immune systems and not the general public. And those doses wouldn't become available until February, when people who were immunocompromised received their first third doses in August. So I know it's confusing, but I wanted to just make some clarifications today to try to clear up any confusion folks might have. I get asked questions about this all the time in my clinical practice and wanted to share it with the general public. Finally, you can, if you're not sure where to go to get a vaccine, you can certainly go to the state website. It's gettheshot.coronavirus.ohio.gov. But you can also go to individual websites for local health departments, hospital systems, community health centers, and pharmacies. And I personally have checked many of them over the past 2 weeks to see what kind of access we have for all of those 5 years and older for primary doses and for boosters. And there is exceptional access all across our community in many different neighborhoods and in many different locations. So I would encourage you to either go to the state website, which is sort of a clearinghouse location for where you can get vaccinated, or to those individual sites for a location near you. Additionally, our team at the Board of Health and the community health centers continue to focus on taking both testing and vaccinations into neighborhoods so that access to both is never a barrier for anyone being protected from COVID-19. In conclusion, I would like to share a moment of gratitude, as I have since the beginning of the pandemic when I've joined these press conferences. And today I'd like to, in honor of Veterans Day, as my 2 predecessors have done, thank our veterans. We really cannot adequately articulate the gratitude that we have for the ability to live in this country and for all the sacrifices that you and your families have made. I'll never forget the Ohio National Guard coming alongside us in so many different ways over the past year and a half, almost 2 years. You heard County Executive Budish talk a little bit about it, but I personally can tell you that we had spent hours and hours testing in a very high-risk location with a lot of cases, and we were running out of resources, and they surrounded us, came in late at night, and took over and let our staff go home and get some rest. Additionally, the same was true when we began large-scale vaccinations. And that's just one small example, but I want everyone to know what the people who serve our country and our state have done also during the pandemic, despite all the risks to themselves and their families. And so for that, I am incredibly grateful. And finally, I would like to take an opportunity to thank our public health staff at the Cuyahoga County Board of Health and all the other local health departments. We've weathered a lot in these last 2 years. Everybody was sort of coming back to sort of a steady state, and then our cases continue to rise over the most recent surge and even in the most recent week or 2. And our teams have never shied away from stepping up to the challenge, vaccinating people with boosters, and a week later starting childhood vaccinations, all while encouraging people out in the community to have their questions answered and to continue testing. So I just want to give a shout out to the amazing servants in our local health departments, and particularly in our CCBH health department. You inspire me every day, and I'm very grateful for all of your sacrifices over these last few years. With that, I'll turn it back to Devin for questions.
All right. Thank you all very much for your remarks. We now have a few minutes for some questions. So please state your name and media organization when asking a question, and remember to stay muted when not speaking. So with that, we can take a question.
Hi, this is Lisa Ryan, health reporter for IdeaStream Public Media. I just talked with Dr. Robert Wiley, and he was saying that there has been a small increase after months of decline of COVID hospitalizations. And I was just wondering what your thoughts are on that and why you think that that might be.
I can start off on my initial thoughts, Lisa. Thanks for the question. We do know that, we've been through, a pretty large surge from the Delta variant that was sustained for several months. And as is the case and has been the case, that those hospitalizations and sadly fatalities often lag the case reports. Dr. Gullett sees lots of patients in clinic and understands the consequences and how people present. So I would defer to her, but this is not unusual following lags. And certainly Dr. Wiley is seeing that probably in greater numbers than just about anyone, given the size of the Cleveland Clinic system.
Thank you for the question. And just to build on what Terry shared, our emergency departments have never stopped seeing acute COVID cases, nor have they stopped seeing complications from long COVID syndrome. In my clinical practice, I also see both, but often with less acuity in the primary care setting than the emergency departments. I think what you're seeing now is both this lag that we often see when we have the surges, and we've seen in the prior 3 or 4 surges that we've had during this pandemic here locally, but also you're seeing that there is a real fatigue with wearing masks, and there's a fatigue with additional vaccinations for people who haven't yet gotten their first dose. And so most of our hospitalizations in our community and across the state and country are those who are unvaccinated. And in folks who are vaccinated and who may end up sick, they typically, very sick, they typically tend to be older adults. This is what we've seen for many months, especially during Delta. But also, if you talk to people, they often say, well, I thought I was fine. I was vaccinated and I didn't wear my mask and I wasn't consistently masking, or you were, eating indoors in high-risk situations, things like that. So I would just encourage people as they enter the holiday season to recognize that masking is really, really important regardless of your vaccination status. Even if you're tired of it, it really won't hurt you. It's not dangerous. It's really important to protect yourself.
And I would just add, I'm not a doctor. I like my predecessor there, but let me just say, I go out in the community all the time. I see people, I come in contact with people, and I see people, as Dr. Gullett said, people are tired of going through the pandemic and wearing a mask and social distancing and all the things that we've told people about over and over again. And you see people, you go into any store, go into a restaurant, you see people, within, a foot or inches of each other, and you see people talking and having a great time and not wearing masks in many cases. You look in any school, and some schools are better than others at making sure that the kids have the masks on, but that doesn't happen across the board. And then those kids go home and they can infect their families, and they go out and meet other people. It's very apparent to me what's happening, and that's people are getting tired and people are going out and they're not paying the attention that they did before.
Thank you, Lisa, for your question. Any other questions? All right. Well, thank you all very much. That concludes this week's briefing. Thank you so much for joining us, and we will see you in a few weeks. Have a great day.